Hi there, Shane and Caitlin here, and welcome to Science on the Table.
The podcast that covers all things South African science, where we take the tough stuff and break it down into bite-sized bits so you don't have to.
That's right, from soup to nuts. So let's lay it all out on the table.
The views and opinions expressed in this podcast are those of the hosts and guests and do not necessarily reflect the views of any affiliated institutions or organizations. Science is always evolving, and some information may become outdated as new research emerges. Always consult primary sources or professionals for specific advice, as this podcast is for informational purposes only.
So today we have Janine joining us. Welcome to the show, Janine. We are very delighted to have you on the show, and we are eager to hear what you can tell us about Mpox.
Perfect. Thank you, Shane and Caitlin, for having me. I'm very happy to be with you tonight.
We are super happy to have you here, Janine. Before we start, we want to ask you to tell us a little bit about your expertise and the type of work that someone in your profession would do sort of like on a day-to-day basis. So we can give our audience a little bit of a sense of who you are, what you're doing, what you're all about. Can you tell us what is an epidemiologist?
Yes, perfect. Thank you. So an epidemiologist is someone that we would term as a disease detector. So epidemiology literally means the study of what is upon the people. So we try to figure out why certain people have a specific kind of disease. We want to see why are these specific people affected and not other people affected. We want to understand the patterns of the disease. How many cases of this disease do we see in a year? Is this normal for us? Is this abnormal? Do we have an outbreak, seeing more cases than we expect and then investigating it? So we can do a lot of surveillance. So looking at the diseases, what is normal for us, keeping track of it. And then so that if we do see an increase in the cases, then we know something is going on and we can go and investigate. So a lot of what I do as if infectious disease field epidemiologist is, like disease patterns, disease surveillance, outbreak investigations, report writing, data sense making, things like that.
So Janine, just on that note, what did you have to study to become an epidemiologist? What are your qualifications and what are the general qualifications to become an epidemiologist?
I think I took the long way round. So I started with doing my BSc. So I did it in microbiology and then medical microbiology. And when I was in medical microbiology, I really became interested in preventing diseases from happening. Not just, not only diagnosing it, but trying to understand why is it happening and to prevent it. So that's then when I applied for my Master's of Public Health. I did this through the University of Pretoria and the NICD. Now, you'll hear a lot about the NICD tonight. The NICD is the National Institute for Communicable Diseases. They have a program that they run, which is called the South African Field Epidemiology Training Program, so SAFETP. And this program, it's a 2-year program where you study epidemiology. You get a diploma in epidemiology. We study a lot about diseases, disease transmission patterns, doing epidemiological studies, doing biostatistics and statistical analysis. And then with that and with the University of Pretoria, we get a Master's of Public Health. So that's what I did, the SAFETP program. So to be an epidemiologist, you would have to do a degree in epidemiology. There are a lot of universities that do offer this degree. And I know, so for me, it was a postgraduate training that I did, but in some universities also do offer it as an undergraduate degree. So as an undergrad, you can already go into public health and study public health, disease transmissions, epidemiology, all of those things that I spoke about.
That's fascinating. So this a topic that's on a lot of people's lips nowadays is Mpox, formerly known as monkeypox. And as you've mentioned, you do study disease patterns and you do surveillance. And from what I believe, Mpox is a notifiable disease. Correct me if I'm wrong, but maybe we can start at the basics and just define what is Mpox and also what is a notifiable disease.
Okay, perfect. Thank you, Shane. Yes, as you said, Mpox is a disease that's caused by a virus. So the virus that causes Mpox is called the monkeypox virus. And I want us to be able to distinguish between the two, because we no longer call the disease monkeypox, because there was a lot of stigma that was associated with saying that people have monkeypox or they are affected by monkeypox. So the WHO and all of the experts made a decision to change it to Mpox. So now Mpox is caused, as I mentioned, by the monkeypox virus. This is a virus that can infect people and make people sick. This is actually, it's not a new virus, even though we've only seen an increase in cases since about 2022. It was first detected in monkeys that was used for research in Denmark. And this was in 1958. And that's where the name monkeypox comes from, because these monkeys had like all of these pox, these pox-like lesions. And that's where they came with monkeypox. And the first human case of Mpox was in Congo in 1970. So a very interesting virus. We do sometimes in countries that do see a large number of these cases and where we can expect Mpox cases. So these are countries that will term as endemic for Mpox. Zoonotic transmission can occur, which means that it can go from an animal to a human, but we also see human to human transmission, which is what we are currently seeing.
So, Janine, Mpox, as I understand, is being referred to as an epidemic at the moment. Can you explain to us what does that terminology mean? I think everyone starts to get a bit panicky when they hear words like an outbreak or an epidemic. And how do you officially declare something as an outbreak or an epidemic?
Perfect. Thank you. So I think that is the declaration of an outbreak or an epidemic is really, it's disease specific. Outbreak and epidemic are words that we use interchangeably, but they mean the same. And what they mean is that we are seeing more of a disease than we are used to, right? So let's say, for instance, cholera is caused by a bacteria. And South Africa is not endemic for cholera. So we're not used to seeing cholera cases. So we know that if we have one cholera case, we would say this is an outbreak because it's unnatural for us. So it's just something that we're not used to. And then we would concentrate all of our efforts on making sure that we stop the spread of this cholera case. For other diseases such as Shigella, we are used to seeing Shigella cases. This is normal for us. What we would then do is we do the surveillance that I spoke about in the beginning of the podcast. So we will have a look and see how many Shigella cases do we get in a week, in a month, in a specific period. Then if we see that, okay, so we know it's normal for us to have 5 Shigella cases a week. Now suddenly for 2 weeks, we had 20 Shigella cases. So then this would serve as an alert for us. So we go and we investigate and we try and we see what's going on. And then generally, if these cases are linked, then we'll say that this is an outbreak. Just to put it in simple terms, anything that is unnatural for us, that we're not used to seeing, can be declared as an outbreak or an epidemic.
So Janine, just to loop back to my initial question, does this link up with what you've just explained, Mpox being a notifiable disease, that it's not endemic to South Africa? So, and now we are seeing a surge in cases, which is kind of out of the norm for South Africa. And that's why whenever there's a case, we would notify the health authorities. Am I correct in saying that?
Yes, as you rightly said, Mpox is a notifiable medical condition. So we have the NMC. So that's the notifiable medical conditions, and I'm going to refer to it as NMC. We have over 50 conditions that qualify as NMCs. So there's different categories of NMCs. We have from category 1 up until category 4. Now, these NMCs are gazetted, it's regulated. So, and what it is about, it's asking healthcare professionals to notify, so to let someone know if there is a disease, any NMC disease, right? We have Mpox is a category 1 NMC, which means is that we want to know about it within 24 hours. So the moment someone makes a diagnosis or they suspect someone might have Mpox, then they would notify it. So we have different channels that we use for the notification. But as soon as they suspect that there is Mpox, they would do the notification. We will get alerted. And this is really so that we can respond to it. A lot of the category 1 NMCs are epidemic prone, so they have the ability to cause outbreaks and epidemics. So we want to be able to do public health actions very quickly so that we can stop the spread of this disease.
Is there currently an outbreak of Mpox in South Africa?
There is. So currently we are seeing an outbreak of Mpox so globally. So far for 2025, we have seen 7 cases of Mpox in South Africa. So South Africa is not endemic for Mpox. So this is unnatural for us. And that's why we say that we do have an outbreak. It was one case was in a traveler that went to a country where they also are experiencing Mpox cases, and he returned back. He tested positive for Mpox, and I think some of his contacts tested positive. Then we also had another case test positive, and some of his contacts tested positive. So we do have an outbreak. I spoke about the NICD earlier. The NICD is doing surveillance of Mpox as well, together with the Department of Health. So on the NICD's website, there is an Mpox dashboard where you can go and have a look, and you can track the cases to see what is going on. South Africa is not the only country experiencing an Mpox outbreak. So Mpox has actually spread to over 100 countries. And in Africa, it is affecting about 15 of the 55 African states. And some of our African members are struggling a lot, like DRC, Democratic Republic of Congo. They are struggling with a big Mpox outbreak. We've also seen Mpox cases in some of the European countries as well. Since 2022, we've actually seen this increase in Mpox cases. So WHO, which is the World Health Organization, and other public health practitioners will often refer to it as the multi-country outbreak of Mpox, because we have so many countries that is affected at the moment.
So, Janine, previously you mentioned that Mpox has been around for quite some time, and we're currently in an outbreak. But how does this current outbreak compare to previous outbreaks when we talk about scale and severity?
Thanks for that question, Caitlin. So I think that really, it depends on the disease, the virus itself and the disease that it causes. We can have a look at if we do a comparison of some of the diseases, because each disease, they spread differently, they have different impacts, their morbidity, the disability they cause, the consequences are very different. It's hard to compare having a look at it. If we have a look just at numbers, then Mpox has spread to over 100 countries with more than 130,000 cases that have been reported and 300 deaths. But if we then want to compare it to COVID-19, this big pandemic that we spoke about earlier as well, COVID has spread to 229 countries. So I think the majority of the globe was affected. We had over 700 million cases, and we've also seen a lot of deaths. So we had about 7 million deaths of COVID. The COVID pandemic was really devastating, and we know about all of the social impacts and consequences that COVID also had. Then if we compare it to the 2014 Ebola outbreak, we had over 28,000 cases and over 11,000 deaths. I think each disease, can cause a lot of disruption for a country, for patients, for the family and friends of patients. So it really does differ. But so far, Mpox is more localized, or can we rather say it has spread, but we're not seeing numbers as we are seeing that we saw with COVID, if that makes sense.
That makes sense, Janine. And can I ask, currently there's an outbreak of Mpox, so it's an epidemic. And with COVID-19 was classified as a pandemic. And if I'm correct, an epidemic is a disease that's spread to a limited region, whereas a pandemic has spread more globally.
Yes. So an epidemic is, as you're saying, more localized, looking at it like a local level, seeing that this is unnatural for us. So anything that we're not used to seeing, we can term an epidemic. Now, a pandemic is something that has spread more worldwide and is causing a lot of disruptions, and also has the ability, to spread further.
Thanks. That makes sense. Again, looping back to what you've said previously on following up on the contact of a specific case brings me to the next question. How is Mpox transmitted? And when you do, can you maybe also elaborate then on what contact tracing means in epidemiological terms?
Okay, yes, definitely. Mpox, I think I alluded to it in the beginning of the podcast as well. So we really see Mpox transmitting in two ways. In the countries that is endemic for Mpox, so that would be Central Africa, West Africa, we can see zoonotic transmission of Mpox. Zoonotic transmission means that this is a disease that transmits from an animal to humans. And this can be from animals such as rodents or primates. And when people work with these animals, or when they hunt them, when they slaughter them, then they can get the Mpox disease from the animal. So that's the one way. The other way that we've been seeing in this multi-country outbreak of Mpox is actually human-to-human transmission. So Mpox is transmitted through prolonged, close physical contact. So you have to have contact with the infectious materials from a patient. When I talk about infectious materials, what I mean is, so looking at some of the lesions that they have. So we have those rashes and the lesions. That's where the virus is in. It can also be the lesions and the scabs are the ones that's very infectious. So if someone uses a blanket that has been used by an Mpox patient and there's lesions and things on it, that's how they can get Mpox. Through sexual contact of someone with Mpox as well, things such as mouth to mouth contact, but you really have to come into contact with those scabs or those lesions. Then for the healthcare workers, respiratory transmission is also possible, but this is mostly through prolonged exposure and when our healthcare workers, when they do invasive procedures, but we're not really seeing the respiratory transmission in this current outbreak. So on the topic of contact tracing, as I mentioned before, Mpox is infectious. It has the ability to cause outbreaks or epidemics. So we really want to be able to prevent additional diseases of Mpox. So once a healthcare practitioner notifies a patient with having presumptive Mpox, then what the health authorities would do is they would ask the patient for a history of all of the people that they were in contact with. And then the health authorities will follow up with these people to test them, to just make sure that they don't have any signs and symptoms and that they are okay. So it's trying to get to the patients very quickly if there has been transmission, to make sure that we can support them throughout this disease, and then to try and prevent additional cases of Mpox as well.
Okay, that's good to know. We've got a little bit more insight on that now. So you mentioned briefly that one of the symptoms of Mpox is a rash. Can you walk us through some of the other symptoms? I think that's one of the things that the larger public is more concerned about is, how do I know if I might potentially have Mpox, and what are the symptoms I need to look out for?
Mm-hmm. Yeah, very good question. So I think Mpox can also be confused with other diseases, and I think other diseases can also be confused for Mpox, because Mpox can start with flu-like symptoms. So we have an incubation period of Mpox for about anything from 1 to 21 days after you've been in contact with infectious material. So, but usually within a week, then people can start experiencing signs and symptoms. Symptoms can self-resolve, and it can get better within 2 to 4 weeks, but people with a weakened immune system, children, pregnant women, they can have more severe symptoms and it can last longer. So as general Mpox symptoms, you can have a fever, sore throat, headache, muscle aches, back pain, things like that, flu-like symptoms. You have low energy. But then what we are also seeing in Mpox is that you can have swollen lymph node and then this telltale rash. Not everyone has a rash, but the majority of patients do. Some people start with a rash, other people start with a fever, muscle aches, sore throats. And we do have a lot of viruses that can cause a rash. So when someone goes to the healthcare practitioner, they would often test for a lot of pathogens such as chickenpox and herpes. So other diseases that can also cause rashes. This Mpox rash can generally start on the face and it spreads over the body, and then it can go to the palms of the hands and the feet. Can also start, so it generally starts where you had contact with that infectious material. So it can be on the genitals as well. It can start as just like a flat sore, and then it later on continues into this blister that's filled with liquid, which can be really itchy and very painful. And as the rash now starts to heal, it will scab over, it will crust and it will fall off. So it's really like those scabs, those lesions, those rashes that we've spoken about. That is the infectious material.
Thanks, Janine. With Mpox symptoms being very general and the fact that they could be confused with, initially at least, with other diseases or the symptoms that other diseases present, diagnosis is obviously very important. How do doctors or healthcare professionals go about testing or diagnosing in maybe the laboratory or in the doctor's rooms a patient for Mpox? Where would we start? Do we draw blood? Do we just take a sample from the lesions? Or if you could just maybe walk us through that.
Yes, perfect. Thank you so much. So I think what it starts with is also really good history taking. Because as we mentioned, we're not endemic for Mpox. So you have to have had contact with infectious material or with a patient with Mpox for you to have Mpox. So it really does start with taking a good contact history of asking, where have you been? Have you been in touch with people with a weird rash or that was diagnosed with Mpox or anything like that? There is a lot of guidelines available for healthcare workers with pictures of how they can distinguish Mpox from other diseases, which helps. And then they also can discuss the disease with the NICD. The NICD is a hotline that the healthcare workers can contact, and then they talk to they will talk to a doctor on call, and they will talk through the symptoms together. They can try and figure out, is this Mpox? Is this not Mpox? So we do have infectious disease specialists that can help and consult. Then if they do determine that, yes, we need to investigate this patient a bit more for Mpox. Let's say that the rash really looks like it might be Mpox, or we had sexual contact with unknown person. We don't really know their history or if they had a rash or anything like that. Then the healthcare worker can take a swab of the rash, those lesions, because as we mentioned, the virus is really in those lesions, and then send it away to the NICD. The NICD will then do a PCR. This is a polymerase chain reaction where they're trying to look for the genetic material of the virus within that swab specimen. And then this is how they can say, yes, this person does have Mpox or not.
Great, thanks. Just for our listeners, if you listen to our first episode on DNA, you might remember that we've mentioned something about conserved regions in your genome or specific genes, and that's what Janine is referring to. So how this PCR test works is the test actually targets one of those very conserved regions that is known to always be in the Mpox genome, for example, and that's how the doctors and the laboratory personnel would know that this sample and this person is positive for Mpox or negative. You've alluded to that just now, but when is a good time to get tested? And are those lesions, maybe it's two questions in one, but when is a person infectious or most infectious? Do the scabs have to be at like a specific stage? And then do those diagnostic tests also only turn positive at a specific like stage of the disease?
Thank you for that question, Shane. A person with Mpox can be contagious from when they start showing the rash and those lesions. They are infectious throughout having the rash and the lesion, and up until when the last lesion actually scabs over and falls off. So it can range anything from 5 to 21 days. This is why they take a swab of the lesions, because those are the infectious ones, and why we also have to be careful of sharing blankets and towels and things like that with an Mpox patient. In hospitals, when we have an Mpox patient admitted, we would perform infection prevention and control to make sure that we take care of the patient in a safe way. We handle the linen and we're able to assist the patient in a way where we don't transmit the disease as well.
I know I feel a little bit better knowing the process of this infection, and I'm sure our listeners feel a little bit more informed about it too. Thank you for that. That was wonderful. Now, one of the things, there's a lot of controversy about vaccines, but can you tell us, is there a vaccine available for this virus? Is there any kind of prophylaxis that we can take or anything along those lines?
Yeah, so currently there is a vaccine available. In some of the other countries within this multi-country outbreak, remember earlier I mentioned that we've been seeing an increase in Mpox since about 2022. So we've been managing this disease for a few years now. So there is a vaccine available, and these other countries did make use of the vaccine to prevent additional cases. And as I'm sure your listeners will also know, and hopefully you'll do a podcast on vaccines as well, we use vaccines so that we can get a quicker immune response if we are exposed to the disease. The vaccine is safe and effective. It has been used in this multi-country outbreak in other countries, and it has also been around for quite a while. So this vaccine, unfortunately, is not readily available in South Africa at the moment because we're not endemic for Mpox. And we haven't seen a lot of cases since 2022. In 2024, we had 25 Mpox cases. And now so far for 2025, we've had 7. So we don't have readily access to the vaccine. South Africa is working on getting hold of the vaccine, and the vaccine will be given to people at a higher risk of contracting the disease. So that is very exciting. And I'm very excited for this vaccine to become available to our people.
Since we are trying to educate our audience, I'd just like to take one step back and comment on what Caitlin has asked. So she has asked whether there's any prophylaxis available, and the definition of that is just any treatment given or action taken to prevent a disease. So if you think about HIV, lots of people take PrEP, which stands for pre-exposure prophylaxis, meaning it's a treatment that you take, a medication, a tablet that you take before exposure to the disease, which ultimately helps to reduce the risk of infection. Thinking of the current status of Mpox in South Africa, should the general public be concerned about it? And is there any possibility of the virus escalating to pandemic levels, like what we've seen with COVID-19, for example?
With COVID. So I think people should be vigilant for Mpox. It does not transmit as effectively as COVID. So you really have to be in contact with someone. And that when I say contact, I mean you have to have physical contact with someone with Mpox for you to get the disease. I think the risk to the general public is low at the moment. Of course, it is good to remain vigilant, especially if you are meeting new people, if you're having multiple sexual partners or casual sex, then you really need to be vigilant, know about the signs and symptoms, know what to look out for. Mpox has, as I mentioned earlier as well, it has spread to several countries. So a lot of countries are currently battling with this outbreak of Mpox, but scientists do not expect it to reach the same pandemic levels as COVID, because COVID-19, which was caused by the severe acute respiratory virus number 2, SARS-CoV-2, which we call it, was transmitted through respiratory droplets, right? So Mpox is not as contagious as COVID, so it does not spread that effectively. So Mpox has a reproductive number. What a reproductive number means in epidemiology, it's the number of people that one person with Mpox can transmit the disease to. The reproductive number for Mpox is about 1.5 to 1.7. COVID had a R naught of 1.4 to 2.4. So we can see secondary cases. So secondary cases means a contact of an Mpox patient getting Mpox, but it will not spread to the same level and have that same devastating impact that COVID-19 had a few years back.
We have discussed quite a lot in terms of content, but I think one of the important things we need to talk about is what do we do in terms of treatment? What is available for patients who do contract Mpox? What can we do in terms of treatment?
Thank you, Caitlin. I do think if you think that you might have Mpox, it is always good to go and consult a healthcare worker so that they can assist you with a diagnosis and with this disease progression. At the moment, treatment for Mpox are mostly supportive and for symptom relief. So we're using pain medication, using medication to reduce fever, making sure that we take care of the skin, those painful lesions. So looking at the skin care, making sure the patient is hydrated, the patient gets a lot of rest, because this is a disease, of course, that they are battling with. We do have a medication which is called tecovirimat. They sometimes call it Mpox as well. This we can give to patients with advanced Mpox, but it's not readily available. It's not something that we can get from a general practitioner, such as we get antibiotics. So we don't have a large stock of tecovirimat because, as we said, like this is multi-country outbreak, everyone is using tecovirimat. So we don't have a lot of stock available. The healthcare worker will be in discussion with the NICD, with an infectious disease specialist, to see if this patient needs tecovirimat. And that's why I said, if you do suspect Mpox, to go to a healthcare worker and they can help you.
Thanks, Janine. I think what a lot of people would want to know is Mpox deadly? Which also leads me to another question of an epidemiological term called case fatality rate. So if you can maybe just elaborate on that and explain what that means. Should people really be worried when they're infected? Obviously, you don't want to get sick, but should I be so worried that there's a possibility that I might die?
Mm-hmm. Thank you for that, Shane. So I think let's start with the question about the case fatality rate, which is CFR. We use that in epidemiology to see how deadly a disease can be. So what we do to calculate the CFR is we take all of the deaths that was caused by a specific disease, and we divide it over all of the cases that we've seen with this specific disease. And of course, we're looking at it at a specific time period. So sometimes some diseases can have a high case fatality rate, like Ebola. It has one of the highest case fatality rates. I think earlier I mentioned about when we spoke about all of the different outbreaks and how Mpox compares. We did say that Ebola had about over 3,000 deaths, and we had 28,000 cases. So it gives us a case fatality rate of about 40%. And in Ebola, it can go up to about 80-90%. But then I have to mention as well, they do have a vaccine for Ebola now and treatment. So the CFR is not as high anymore. But then Mpox has a case fatality rate of 1.4% to 3.6%. So, of course, we don't want anyone to be dying from a disease or from Mpox. In the majority of cases, Mpox is mild and it's not deadly. So people, they can manage with the treatment given by the healthcare worker, and they get better within about 2 to 4 weeks. But then in some other cases, in people with a suppressed immune system, in children, in pregnant women, the disease can be severe and can result in having complications or having death. And that's why I keep reiterating that if you do think that you might have Mpox, to rather go to a healthcare worker and work with them to make sure that they support you throughout this disease, so that if there is any danger signs, that intervention can be conducted quickly.
Janine, tell us, is Mpox in any way related to COVID?
I think so. The only way that Mpox is related to COVID is that they are both viruses, right? So if we use this big term of pathogens, they are viruses. But Mpox is not related to COVID at all. COVID-19 is caused by the SARS-CoV-2 virus, severe acute respiratory syndrome coronavirus. And as it says in the name, COVID-19 is a coronavirus. We can say we have animals, but we have all of these different kind of animals. So animals is what we put is our big umbrella. That's our viruses. Now, COVID, let's say COVID is an elephant and Mpox is a cat, right? Mpox is, I think I mentioned it before as well, Mpox is caused by the monkeypox virus, and the monkeypox virus is actually in a different genus and family as COVID-19. Monkeypox virus is in the genus orthopox virus, which is in the family of Poxviridae, and this is the same family as smallpox. And I think you are aware that smallpox was eradicated in 1980 as well. COVID-19 and Mpox is not related at all.
Thanks, Janine. We just want to clarify that and also make sure that our listeners know that these two diseases that I want to say all of a sudden appeared on our radars are not related at all. Another question that I have, and this is based on a news article that I read recently on the latest infections in the Gauteng province in South Africa, is about, I think it's 3 cases, and it was, I think you've alluded to it earlier on, transmitted locally, I think to 2 individuals. Correct me if I'm wrong, but this was from one individual who traveled from Uganda. And what I also read in the news article is that the Mpox virus that was detected in these individuals is from clade 1. So if you can maybe just elaborate or explain to us what a clade means, and also just confirm that I'm relaying the information correctly.
Yeah, thank you for that, Shane. Yeah, so when we talk about the virus terminology, we use clades to refer to a virus, to try and understand how a virus evolved. A clade is actually a group of viruses that shares a common ancestor. They share a genetic sequence, but at one point, some of their genetic material changed. So they can be called a variant now. And a lot of these variants can be in one clade. If there is a totally different mutation, then this virus can be in another clade. We group them together in another clade. So if I can try and give an example. So let's think about it using a family tree, right? So now let's say, Caitlin, your grandmother had two children, your mother and your uncle. They are genetically related, but also different from each other. Your mom now has two children, let's say you and your brother. Your uncle has three children. If we use the virus terminology and way of grouping things, then you, your mother, your brother, they could all be in one clade, and then your uncle and his three children will be in a different clade. So we're all related. We're still the same family, but we are different, right? So that is what a clade means. So we're all related in this monkeypox virus, but we are also genetically distinct. So there's something in us that makes us different from the other clade, from the other virus.
Thanks, Janine. That's a wonderful analogy. I think that'll make it a lot more clear for the everyday person who's not scientifically inclined or more jargon inclined. So thank you for that. Which are the clades that are driving this current Mpox outbreak?
Yeah. So when we are looking at Mpox, we have two clades. We have clade 1 and clade 2. And within the clade, we can have clade 1A, clade 1B, clade 2A, clade 2B. But I'm not going to go into all of those different A's and B's. Clade 2 is the clade that originated in West Africa. It's less transmissible than clade 1, and it does have a lower fatality rate. So case rate that we spoke about earlier. Clade 2 is the clade that has mostly been driving this 2022 multi-country outbreak of Mpox. And this clade mainly spreads through sexual contact and has mostly been affected the men having sex with men community. Now, if we look at clade 1 originated in Central Africa. It is more transmissible, and it also has a higher case fatality rate. As clade 1 is more transmissible, we do see household contacts of Mpox patients test positive. We can see secondary cases especially from clade 1. And now, actually, in 2025, I think the end of 2024, 2025, we have seen an increase in this clade 1B cases being recorded across the globe. We have about 15 countries that have recorded cases of clade 1B. In 2024, I think I mentioned it earlier as well, we had 25 laboratory confirmed cases of Mpox. And all of these patients were associated with clade 2B. They were mostly in males aged 17 to 43 years. So this is in keeping with this multi-country outbreak. Now in 2025, we're seeing a change in epidemiology. These cases that we have seen is actually associated with clade 1, and it is affecting both males and females, or also the similar age range of about 15 to 44. But we are seeing more clade 1 cases at the moment. I've mentioned it earlier as well. If you do want any information on the clades and the number of cases in South Africa, the NICD website is a really good resource for more information and reading.
Thanks. We will put that link up in the show notes and on the socials for anyone who does want to access that. We'll make it available for the listeners.
Janine, are there some basic things that I can do to protect myself from infection, aside from the general things like good hygiene practices, like proper hand washing, because I'm sure that would also play a role. I mean, you've alluded to like sharing bedding with someone who is infected with Mpox and who might have these lesions, are there any additional things that I can do to protect myself from infection?
Yes. So one of the risk factors that has been identified is having multiple sexual partners and practicing unsafe sex. So one of the ways that you can protect yourself is to practice safe sex and limit your sexual partners. Also, be open to discuss any signs and symptoms with a new partner. If you are with someone that does look like they have an Mpox rash, rather try and discuss it with them before you have a sexual encounter. As you rightly said, Shane, we want to avoid close contact with a patient who has Mpox, or with a rash that looks like it's someone with Mpox. And as I mentioned, really, it is this close contact. So if you are taking care of someone with Mpox, just make sure to wear the appropriate protective clothing, like wear gloves. If you are helping them manage their lesions, make sure you wash your hands. Hand washing, hand hygiene, always important. Don't share bedding, blankets, towels with Mpox patients. If you do see a rash in some other people, try and minimize the contact with that rash as well. It's very important so that you are vigilant and know the symptoms, check yourself regularly. And as I've mentioned, if there is anything that you are concerned about, go to a healthcare worker, discuss it with your doctor. In countries where Mpox is endemic, which is not the case in South Africa, you can avoid contact with wild animals that can carry the virus. But as I mentioned, that's more Central and West Africa. Although vaccination is not readily available in South Africa at the moment, vaccinating against Mpox is also another way to prevent infection. I think in South Africa, the Mpox vaccine will mostly be used for high-risk individuals, people, household contacts of a patient with Mpox, or healthcare workers that manages a Mpox patient. They are really the people who we'd want to vaccinate first. But when we get the vaccine, vaccinations are always a good idea to protect ourselves from Mpox. For us to protect ourselves from a disease, understanding the disease, how it is transmitted really helps. Mpox is transmitted through prolonged close contact, so really skin to skin contact, and this especially with the lesions. So if we try and prevent that contact with an Mpox patient, then that could also help and prevent someone from getting the disease.
And then lastly, Janine, we want to round off with a little bit of hashtag fake news. So can you tell us about any misconceptions around Mpox that people should be aware of?
Yes, there are a number of misconceptions and myths floating around at the moment about Mpox. I'm only going to mention a few that I really want to highlight tonight. We've spoken about it in the podcast already this evening, and it's that people think Mpox is a new disease, and we've mentioned it's not. It's been around for a really long time. The first human case of Mpox was actually in 1970, and we have seen more localized outbreaks in specific countries across all of the years. The monkeypox virus was actually detected in 1958, so it's been with us for a really long time. One of the other big misconceptions is that Mpox only affects the gay, bisexual, or men having sex with men, the MSM community, which is not the case, because anyone can contract Mpox. We spoke about the transmission, how it happens. So it's not just a community of people that is at risk of getting Mpox or who can get Mpox, regardless of their sexual orientation or their gender identity. The 2020 outbreak did see a higher number of cases among the MSM community, but this is more due to the social networks within this community rather than any inherent susceptibility that one might think the community has. And again, Mpox spreads through physical contact, which can occur in any setting. It can occur in any relationship. I've mentioned it before as well. We are seeing household contact, so family members of an Mpox patient test positive for Mpox. One of the other misconceptions, I think we've also discussed tonight, is that Mpox is as contagious as COVID-19, and people panic because they think we are going into the same pandemic levels and we're going to have lockdown measures and things like that, which is not the case. And Mpox, again, is not as contagious as COVID-19. COVID-19 can spread through respiratory droplets. Mpox really needs prolonged close contact, that is skin to skin. Following that, people can sometimes think that Mpox spreads through casual contact or being in the same room as someone with Mpox, which again is not the case. You need close skin to skin prolonged contact. You can't get Mpox by just a casual handshake or being in the same room as people with Mpox. You can't get Mpox from a water system or an air conditioning system. So being in the same room, in the same building, in the same environment as an Mpox patient, that's not how you get Mpox. One of the other misconceptions that people have is that the vaccine for Mpox, we've spoken about vaccines, are new and untested, which again is not the case. The vaccines that we are using for Mpox has been around for a long time. It's undergone rigorous testing for safety and efficacy. So they were developed for use against smallpox. And I've mentioned smallpox earlier in the podcast as well. So these vaccines have been around for a while. It's not a new vaccine. It is tested and it is safe. One of the other misconceptions is that Mpox is a sexually transmitted infection, which again is not the case. Although it can be transmitted through sexual contact, because again, it's this prolonged skin-to-skin contact that is the risk. Wearing a condom won't protect you from getting Mpox, so we don't really see Mpox as a STI, although sexual contact can drive the Mpox transmission. So I think really those are the main misconceptions that I wanted to highlight tonight.
Thank you, Janine. That's really a very nice overview. I think you've given us quite a good scope of what Mpox is, starting with the basics, also covering the relevant information in South Africa and explaining very important epidemiological terms. And I think you've done a stellar job in informing not only the audience, but both myself and Caitlin on the Mpox topic, and something that's so topical at the moment, and which with information that is very important for the general public to know about and also to understand. Mm-hmm. So on that note, I just want to thank you for coming on to the Science on the Table podcast. We really appreciate you sharing your expertise and taking the time out of your schedule to talk to us. And I can tell you speak with a lot of passion, a lot of knowledge, and we really appreciate you emphasizing that in the way you explain the messages and relate the information to all of us. So once again, thank you very much, and you were a great guest, and we would be very fortunate to have you on the podcast again in the future. From myself and Caitlin, thanks once again, and we catch you next time.
If anyone has a question for Janine, please pose it to us. we will get in contact with her on your behalf. And then in a later episode, we are going to address all of those questions that you may have, and we'll update you on any new Mpox news that comes out.
Perfect. Thank you, Shane and Caitlin, and to all the Science on the Table podcast listeners. It was an absolute privilege to be with you tonight. I really do support you making the information available to the community out there and to the public. And I would love to be on the podcast again. And I thank you.